What was the most unusual place you've seen endometriosis in a patient?
In the eye.
One of the ways in which endometriosis has been theorized to spread throughout the body is via the lymphatic system. But where exactly has endometriosis been found in the body? Endometriosis has been found in every organ, nerves, ligaments, and joints. Symptoms can be indicative of spread. Though, side note, some people with endometriosis are asymptomatic and present no symptoms. Common sightings occur within the pelvic area. Ovaries, think endometriomas, also known as chocolate cysts. The fallopian tubes, where blockages can occur affecting the ability to conceive. The pelvic peritoneum, that's the layer which covers and protects your organs. And deep pelvic structures, which include tissue between the rectum and the vagina, the rectosigmoid colon, and uterosacral ligaments. These are bands of tissue that connect lower parts of the uterus, or cervix, to the base of your spine, your sacrum. These bands effectively help support your pelvic organs. And then you have extra-pelvic areas, also known as elsewhere in the body. Endometriosis has been found within the gastrointestinal tract, your GI tract, which literally runs from your mouth to your anus. That's right, I said anus. Symptoms can include bloating, nausea, painful bowel movements, bowel urgency, rectal bleeding, and the feeling that you haven't completely evacuated your bowels. Endometriosis has also been found within the urinary tract, which includes your bladder and kidneys. Symptoms include bladder urgency, painful urination, and blood in urine. But as for the kidneys, many women with endometriosis have no symptoms. And so the endo condition of kidneys is often referred to as silent kidney loss, sometimes resulting in organ removal. And then you have reports of endometriosis being found in the chest, the thoracic region, so your lungs, diaphragm, and ribs, with diaphragmatic endometriosis being the most common. Symptoms include chest pain, shoulder pain, shortness of breath, neck pain, and coughing up blood.
One of the symptoms of thoracic endometriosis is hemoptysis. Hemoptysis means coughing up blood. Usually for thoracic endometriosis, this is not a dramatic hemoptysis as it can happen with other conditions. It is actually sputum streaked with small amounts of blood.
And that's not all, my friends. Endometriosis has been found in the heart, nose, and even the eye.
What was the most unusual place you've seen endometriosis in a patient?
In the eye.
In the eye?
In the eye of the patient, yeah.
So there you have it, the EndoSpread Roundup. Key takeaways. 1. This is a serious life-altering disease. 2. If undetected and left unmanaged, as it is for the vast majority of women who are either undiagnosed or receiving inadequate care, endometriosis can progress and affect organ function. And not only that, it affects energy levels from dealing with chronic pain and inflammation, mobility, if endometriosis is affecting certain nerves or ligaments, and your mental health, which is by no surprise if you've been medically gaslighted and lack the right support.